Welcome to this presentation, VNA First Home Care Steps Protocols, a clinical documentation imperative for success in healthcare reform. We're happy that you're interested in finding a program that will give your agency the market edge in this healthcare reform era of transitional care and accountable care. Over the next several minutes, I will be sharing with you the reasons why the VNA First Home Care Steps Protocols are your solution to quality outcomes and a great report card on Home Health Compare. You see, regardless of the changes in healthcare, quality outcomes remain the number one priority. And the VNA First Home Care Steps Protocols are your solution for success in healthcare reform. Today, healthcare is drastically different from the healthcare of yesterday. Today's healthcare of transitional care and accountable care demand data and quality outcomes with closely monitored cost containment. Clinical pathways are part of the answer. They standardize care and provide for predictable outcomes. The use of clinical pathways encourages the patient to participate and take control, and it enables healthcare providers to integrate the total quality management process into the clinical arena. Clinical pathways provide a structured approach to delivery of home care and delineate the patient-caregiver interaction for each visit. Patient instruction is in planned segments and is sequenced over the certification period. A clinical pathway model demonstrates to third-party payers the quality and consistency of care delineated. It clearly states what services are provided and in what time frequency. The structured plan clearly defines the clinical outcome. So why do you need clinical pathways? Well, quality outcomes are an obvious goal of healthcare delivery systems. And the key to producing high-quality outcomes comes through the use of evidence-based clinical practice. Evidence-based clinical practice means that there is consistency and reliability among clinicians' practice patterns. It means that you are following the standard of care. It is no surprise, then, that CMS recommends clinical pathways because they integrate the standard of care. These tools will be a necessity for viability in the era of healthcare reform. Can you say for sure that certain standards are being met for all of your patients regardless of payer or setting? Well, you can if you use clinical pathways. A standard of care is a package of care that all patients should receive regardless of payer. Standards of practice are the interventions we do to ensure consistent quality outcomes. No agency wants to be placed in a position where their standard of care is at stake, but how can you ensure that each and every nurse is maintaining it? By using a clinical pathway. Small differences in care can compound like a bank account and make tremendous differences in your agency's outcomes. Clinical pathways level the playing field. They are a standard package of care. Many of you may still be using narrative notes, and in that case, can you honestly say that all of your clinicians are delivering the standard of care to your patients? Well, the only way to guarantee that is to use evidence-based clinical pathways that have these standards from all of the accrediting bodies incorporated into them. We know that every disease state has specific standards of care. For instance, the American Diabetes Association has specific interventions that need to be completed to meet the gold standard for diabetes care. In an episode of care, clients should be receiving instruction on diet, medication, disease exacerbation, sick days, self-care, prevention. Can you say that all of your clinicians even know the standard of care for diabetes? And are they all delivering the standard of care? Well, with a clinical pathway, you can easily say that and prove that to your payer. Clinical pathways work in the new model of healthcare called the chronic care model. The chronic care model is a proactive, systematic approach to delivering healthcare holistically. It was developed by Dr. Ed Wagner to improve chronic illness care, and it transforms the healthcare delivery system. It turns a reactive healthcare system into a proactive or preventive system. and we know that clinical pathways are the guidelines that have to be used in the new era of healthcare reform. Clinical pathways will help your agency improve continuity and efficiency and outcomes. You will also see targeted reductions in hospitalizations and emergency room visits, meeting the goals of transitional care and ACOs. I mentioned the importance of following evidence-based guidelines. Well, if your nurses are charting narratively, how can you be sure they're following evidence-based guidelines? Well, you can't. But with the clinical pathways, each disease-specific pathway is built on up-to-date evidence-based guidelines. For example, for the diabetes pathway, here are just a few of the clinical guidelines that were resourced and incorporated into the pathway. Clinical practice guidelines were taken from the American Diabetes Association, the American Dietetic Association, the American Association of Clinical Endocrinologists. The accreditation standards were also incorporated, and as these standards change, they are always updated in the pathway, so you never have to worry about it. So, what are clinical pathways? They're a set of interventions and outcomes that must occur for a desired outcome to occur. They're documentation of evidence-based, standardized interdisciplinary care that can be easily individualized for each patient and show variations from standardized processes. So it's easy to see when a client veers off the clinical pathway, and it's very easy to see the reason why. But they do operationalize best practices. They represent sequencing and timing of interventions by clinicians. They are designed to minimize delays, improve resource utilization, enhance quality of care. You can monitor a patient's progress through a clinical pathway, and you can control the patient's progress and get the type of interventions required. It's easily to case manage when you're using a clinical pathway. And they are measured according to standard process and clinical outcomes. In the case of home care, this is an episode of care. But it isn't just the type of interventions that are important. It's also the timing of the interventions. Interventions must build on one another, and the patient must grasp lower-level information before understanding higher-level information. Let's look at the example of diabetes. A patient must be taught very basic safety information, like what is diabetes, before he can understand more abstract or more difficult information, like injection site rotation. Clinical pathways ensure clinician consistency and standardization so that every patient can achieve the highest outcomes possible. This also allows less experienced nurses to provide the same level of care as an expert nurse. Not all of our nurses have the same level of experience and knowledge in each disease state, so clinical pathways help level that playing field. Let's look at the components of a clinical pathway. There are 4 main components: the category of care, visit-specific interventions, short-term and long-term outcomes, and the timeline. The VNAFirst clinical pathways will help your agency with documentation. They consist of a pathway profile, a visit-specific note, CoSteps for comorbidities, variance codes, and variance tracking sheets. Let's take a closer look. The first component is the pathway overview. This is like a hospital Cardex. Here the clinician is able to individualize the plan of care and decide on the specific problems that fall out from OASIS. Specific items on the overview allow the clinician to mark where the patient is on admission and where the patient should be by discharge. This tool also allows everyone to be on the same page. So if a PRN nurse is seeing the patient, she can look at the overview and determine the plan of care and see what is special about this patient or what she should focus on. So little time is lost in addressing specific patient needs. This form is updated just like a Cardex, so the clinician always knows what and when labs are due or treatments. Let's take a look at a sample visit note. There are 3 columns. The first column are the care elements. These are the things we always address in a visit: disease process, medications, nutrition, hydration, elimination, activity, safety, and inter-team communication. As we move to the right of that care element, in this case disease management, we see the interventions for that specific disease. This is the standard of care. All clinicians must either mark a check, meaning that it was completed, or put in a variance code. We have a list of 10 variance codes that help explain why the intervention was not able to be completed. In the third column, we have a comment section for the head-to-toe assessment or agency-specific parameters. Each visit note is unique in that each visit builds on the previous visit. All clinicians are giving the same care on the same visit. This provides consistency and helps your new clinicians, as well as your less experienced clinicians, to deliver excellent care. At the bottom of the visit note is the outcome section. Achieved outcomes are marked with a check mark, and outcomes that are not achieved are marked with a variance code. The first 2 outcomes are always addressing stability, so on each visit, the clinician will address that the patient demonstrates no new or worsening signs and symptoms and that there was no unplanned resource use, like an ED visit or hospitalization. The remainder of the outcomes are all very specific to the interventions that were addressed on this visit. Because each visit builds on the previous one, it is important that the patient achieve the outcomes. Because lower-level outcomes are the building blocks for higher-level outcomes. So if a patient has not met 3 or more outcomes on a visit, it is recommended that the visit be repeated. That means the same material will be presented on the next visit. Otherwise, if you advance the patient, you are setting him up for failure. With the VNAFirst clinical pathways, this ensures that your clinicians are evaluating outcomes on each and every visit. Your payers will want to see this. There are core outcomes in each visit. Look at outcome number 1. Demonstrates no new or worsening signs and symptoms. Number 2. Demonstrates the ability to maintain medical condition in the home without use of the emergency room or hospital. Number 3. Verbalizes purpose, action, and side effects of medications. Verbalizes fluid restrictions and general dietary restrictions. These are all the outcomes required to be met for a congestive heart failure patient. This is what your payers and providers want to see. Again, the outcomes are marked with an X if it is met and a variance code if it is not. This makes it easy to explain your care. The VNAFirst clinical pathways are goal-oriented. The interventions are goal-oriented to help the patient achieve high levels of self-promotion. The interventions are aimed at promoting knowledge and compliance with diet, fluid, activity, medications, and safety, like when to call for help, and avoiding adverse declines or events, and improving outcomes before discharge. Goal-oriented interventions are aimed at preventing exacerbation or early detection, and prevention of emergency room, hospitalization, and prevention of a decline in an outcome. Clinical pathways use variances to explain the care. You can see in this slide that in outcome number 1, it was not met 3 times because of variance code 1, which means that the client was just too sick from the primary diagnosis. You can see that the patient used the emergency room, and he used the emergency room related to the primary diagnosis. As for the compliance of behavior outcomes, you can see a mixture of reasons why the outcome was not met, related to psychosocial, cognitive, caregiver, and primary diagnosis signs and symptoms. This gives you a great picture of what has happened so far in the episode and triggers the clinician to evaluate the care a little closer and possibly to even case conference. We know that our patients come with many diagnoses, and in some cases you have to address those comorbid conditions if you see an educational issue or if the patient is unstable with a comorbid condition. CoSteps were created to address those issues. This is an example of a CoStep for nutrition risk. It is a simple flow sheet with problems, goals, interventions, and outcomes. The clinician can check each box as the intervention and outcome is met. A variance code could also be used to explain why an outcome was not met. This is a simple, easy-to-use tool. It is a care plan in itself. Clinical pathways are unique in that they are a disease management model. The underlying disease management model and the framework for this pathway program is based on levels of patient outcome achievement. This is important for disease management in healthcare reform. The interventions and outcomes change focus and level of disease management as the patient progresses through the pathway and through the episode. In other words, if the outcomes are achieved within certain planned visit protocols, then different levels of disease management are achieved. For instance, in visits 1 through 3, they're typically focused on safety issues. Visits 4 through 7 may be focused on disease control, and visits 8 through 10 may be focused on health promotion or higher levels of self-management. For instance, safety interventions and outcomes are aimed at helping the patient achieve a stable status, prevent an occurrence, or obtain assistance. For example, in visits 1 through 3, some outcomes might be the patient verbalizes how and when to call for help and 3 signs and symptoms of disease exacerbation, and demonstrates no new or worsening signs and symptoms. In visits 4 through 7, disease control interventions and outcomes are aimed at helping the patient maintain a stable status and prevent acute exacerbation of their primary condition. Some outcomes might be they demonstrate tolerance of their medication schedule and their activity and their diet. Health promotion interventions and outcomes are aimed at helping the patient achieve a high level of self-care so they are able to maintain or improve their general health status for their primary and secondary conditions. These interventions also help patients comply with behaviors to prevent reoccurrence or new illness or injury. For these visits, some outcomes might be that they demonstrate the ability to access community resources and they demonstrate appropriate mechanisms for changes in lifestyle. With the use of clinical pathways, the benefits for your agency are many. They improve team communication, documentation, quality of care, and outcomes. They help reduce length of stay, manage your risk, and they are data-driven, which is what we want to see in healthcare reform. Clinical pathways reduce your risk in this risk-driven, value-based purchasing market. Because they are data-driven, you have easy access to variance codes and easy access to the reasons why interventions and outcomes were not met. So clinicians can case manage immediately rather than waiting at the look back to see what went wrong in an episode. Protocols are the key to success in transitional care and ACOs. You will see improved outcomes. Your patients will see improved health and quality of life. You will see reduced agency resource costs and improved clinical satisfaction. They are the key to success in transitional care and accountable care, and they are your marketing tool. With the use of clinical pathways, you will see changes in your home health compare results. Your hospitalization rates will be reduced, and your other indicators like medication compliance will improve. That is because these core outcomes are addressed on each and every visit. The clinician is cued to investigate and perform best practices. So, why do you need clinical pathways? Well, quality outcomes are an obvious goal of healthcare delivery systems, and the key to producing high-quality outcomes comes through the use of evidence-based clinical practice following the standard of care. You need to be ready for healthcare reform initiatives like transitional care and accountable care organizations. You must have clinical pathways to compete in this market. I just want to quickly talk about the difference between our two pathway systems. We also have a one-page pathway called QuickPaths. We offer this version for agencies who want a simpler, less intense pathway. QuickPaths are excellent for new agencies just starting up or agencies who are not interested in collecting variance tracking information just yet. The QuickPaths were developed from the VNA First protocols, but they have fewer interventions and they are more broad interventions. We have really pared them down, but again, they are much broader interventions. In the protocol version, we variance the interventions and the outcomes. In the QuickPaths, we variance the outcomes only. The formats are also different. In the protocols, the interventions are divided up according to care element, and the outcomes are at the bottom of the page. In the QuickPaths, the outcomes are side by side with the interventions. The protocols have 10 variance codes with subcodes for drilling down on a problem. In the QuickPaths, we only have the broad category. For more information about the QuickPaths, there is a webinar, a free webinar, that will provide you with more of that detail. So in summary, clinical pathways are advanced care management, and they are a necessity in healthcare reform for all agencies that want to be successful in the new era of healthcare reform. So call us at 630-236-4603 for more information and to order your starter set today.